Hi, the topic of discussion is lumbar spinal canal stenosis. What is a spinal canal? The canal which is running posterior to the vertebral body throughout the entire spinal column is called a spinal canal. Now, what it contains? It contains spinal cord and the surrounding meninges plus the circulating cerebrospinal fluid. Now, what is stenosis? Stenosis is nothing but narrowing of the canal diameter both anteroposteriorly and laterally. Now, how do we measure the stenosis here? The line drawn from the midpoint of the posterior vertebral body to the midpoint of the interlaminar junction is called as AP diameter. The line drawn from the root of the pedicle from either sides from right to left is called as the transverse diameters. What are the causes of canal stenosis? There are many reasons. The commonest reason of canal stenosis for younger population is disc herniation. Usually, this herniation happens posteriorly. In order to congest the spinal canal, it also can push the spinal cord posteriorly towards the lamina. For old people, the stenosis is usually due to the facet joint arthritis, where the facet joint will get hypertrophied and build new bones. We call it as a spur, and these spurs will go and congest the space of the spinal cord. That can be the reason for bony spinal canal stenosis. The other reason for spinal canal stenosis for the older population is ligamentum flavum hypertrophy. What is ligamentum flavum? It's a ligament which is lining the posterior aspect of the vertebral arch along the lamina, and this ligamentum flavum, as it gets hypertrophied or buckled, it can move anteriorly and compress the spinal cord from backwards to forwards. Okay, the disc herniation will congest the spinal cord from forwards to backwards, whereas ligamentum flavum hypertrophy will congest the spinal cord from backwards to front. In some patients, you will get both ligamentum flavum hypertrophy and disc herniation. These are the people who will be really suffering from the nerve tissue involvement. The other reason for spinal canal stenosis is anterolysis, where the vertebral body will be slipping anteriorly with respect to the inferior vertebra. So, in grade 3 and grade 4 anterolysis or spondylolisthesis, the spinal canal will get kinked, and that will cause the spinal canal narrowing. The canal stenosis can happen due to the central disc herniation or the buckling of the ligamentum flavum or hypertrophy of the ligamentum flavum, or facet joint arthropathy or hypertrophy, or anterolisthesis. These are the 4 common reasons of central canal stenosis. The other uncommon reasons for canal stenosis is fracture, infection, TB spine, or it could be due to tumor, so which can be causing congestion of the spinal canal. Now, what are the clinical symptoms? The clinical symptoms are hugely variable, depends upon patient to patient, depends upon how much of the narrowing has happened. So, it all ranges from mild tingling numbness to the excruciating pain and weakness and even paralysis. Okay, so it depends upon the age of onset, it depends upon how much is the canal diameter, it depends upon how much is the tolerance level of the individual. The neurogenic claudication is the hallmark sign for bony stenosis. It typically happens to the old people, where they will be able to walk for predictable distance every time, and they have to sit, rest for about 2 or 3 minutes, and then they will be good enough to walk again. So, this predictable occurrence of pain at a stipulated time duration is called as neurogenic claudication, which happens on both the sides, unlike the vascular claudication. The other clinical features are tingling numbness, paresthesia, weakness, and probably the symptoms would be bilateral in nature and mild or moderate back pain. So, this tightness of the muscles. So, these are some of the other clinical features, but typically MRI has to be done in order to identify the extent of the damage, and clinically the patient should be correlated by physical examination. Then one can decide whether the patient will be needing the conservative treatment or surgical intervention. Thank you.